Has the era of decentralized healthcare, also known as DeHealth, already begun? Hello from Fabio Fiorentini. Welcome to this new video from Blockchain for Health, where we will finally talk about the impact that decentralization is already having in the field of health and healthcare. Attention! Even though it shouldn't need to be said, just to clear up any doubts and avoid misunderstandings, I want to specify that decentralizing does not mean privatizing. Greater decentralization does not necessarily imply greater privatization. So, in this regard, don't worry. I'm saying this because the topic is extremely hot and extremely sensitive. So, to decentralize fundamentally means to disintermediate, and it does not mean to privatize. The first example that must be mentioned for historical reasons, because it was the first process of devolution rather than decentralization, according to the new meaning of the term introduced in the previous video, was the reform of Title V of the Constitution under the Amato government in October 2001, where in fact the authority over healthcare was delegated to the region. The COVID pandemic served as a sort of extraordinary catalyst for the evolution of certain concepts, such as digital healthcare and the concept of the person. At the center, borrowed from the broader concept of One Health. Now we talk about the person in all their aspects and no longer just as a mere patient. In fact, during COVID, it became clear that in certain situations, providing care in local facilities close to people, even near their homes, worked better than centralized hospital care. Since then, and perhaps even before, in some cases, care has been shifting to the outskirts, to decentralized facilities that therefore need to communicate with each other as nodes in a network. All of this is as planned by the National Recovery and Resilience Plan, the well-known PNRR that we often hear about, specifically in this case referred to as Mission 6, Component 1, Proximity Network, Facilities, and Telemedicine for Local Healthcare. This Mission 6, Component 1 of the PNRR, includes three types of investment. The first concerns community health centers and the care of the individual. The second is the home as the primary place of care and telemedicine. The third is the strengthening of intermediate healthcare and its facilities, understood as community hospitals. So it becomes clear that all of these are like nodes, in fact, of a network. In order for these nodes to communicate with each other, a single communication protocol is needed to enable data interoperability. And then the simplest way to implement all of this, which would already be a big step forward compared to a territorially centralized situation, is to have a single repository, that is, a single healthcare database, obviously national or even regional, which is essentially what will be included in the electronic health record. The new one, called 2.0, by analogy, it's along the lines of SPIDE, which had certifiers that one could use as they wished, maybe even more than one. So these health data could be entrusted to entities trusted by the individual, or even simply self-custody. This would be a further step toward a decentralized evolution of the healthcare system. So, first we have territorial decentralization, where there is a single protocol with a centralized database. Then we will have decentralization of health data with a single communication protocol and a database distributed among individuals. And the technology needed to do this is already available. It's that of distributed ledgers, of which blockchain is a subset. In summary, in a three-level evolution, we move from fragmentation of the database and territorial centralization to unification of the database and territorial decentralization, and eventually, in the near future, to decentralization of both, that is, both the database and the care provided in the territory. The concept of putting the person at the center is not in opposition to decentralization. On the contrary, it actually implies it. In what sense? The concept of putting the person at the center is borrowed from the broader idea of One Health, which actually predates the COVID period, and it was precisely during that time that its full validity was demonstrated, to the point that it has become one of the pillars of future healthcare, at least as a vision. It is precisely the need to put the person at the center, not just as a mere patient, but as a whole person, that makes territorial decentralization necessary. This is to get as close as possible to the person themselves, even at home, thanks to the evolution of technologies such as telemedicine. Speaking of telemedicine, in the spring of last year, GENAS, that is the National Agency for National Health Services, established a public-private partnership, usually abbreviated as 3P, for the creation and management of the National Telemedicine Platform. And it's interesting to see what's written on page 26 of the annex, which is titled Methodological Guidelines for Defining the Scope of Public-Private Partnership Proposals for the National Telemedicine Platform. Document management on NFT, where NFT stands for non-fungible token, that is non-fungible tokens, and represents a kind of digital certificate. Essentially, an NFT is a unique digital certificate of ownership or authenticity of something. At this point, I need to open a brief parenthesis, because maybe not everyone knows what a token is. So, a token can simply be considered the digital equivalent of the old phone token for those of a certain age like mine who remember it. The phone token was used both to make calls by inserting it into the machines, maybe inside phone booths, and it also had an intrinsic value of 200 lyre. Another example of a token could be supermarket loyalty points. In the crypto world, tokens are digital assets generated by smart contracts, which are specific software present on the blockchain. And tokens can serve various functions, such as representing an asset, a service, or value. And they can also be exchanged. Tokenization consists of transforming any type of asset into small, transferable shares, and it can be applied to almost anything, from an honor loan to a work of art, a musical track, or even a single pill. The token economy runs on blockchain. What are the advantages? Maximum liquidity, total transparency for all parties involved, immutability of transactions, complete traceability, disintermediation, and a corresponding reduction in costs. From what is being said here, it seems that the goal is to provide the possibility to create an NFT associated with a telemedicine session so as to have a sort of archive, in other words, a document management system using NFTs. Trying to simplify these concepts as much as possible to make everything a bit more digestible, we can say that the NFT is a sort of link to metadata, which can be considered the patient's health data. And if the metadata were placed on a privately owned server, it could be updated and modified at will. Therefore, there is a smart contract on a specific blockchain that generates the so-called NFT collection, each of which is distinguished by a token ID. Each token ID is associated with an address where its metadata is stored. The metadata can be our health information. Therefore, the token ID never changes, while what does change and is continuously updated are the metadata, except of course for the historical data. And this is where the immutability mentioned earlier comes into play. In theory, the NFT should be stored in a wallet owned by the patient. To view the data linked to that token ID, you must prove that you own the wallet and that the specific token ID is inside that wallet. And to prove ownership of that wallet, it would be enough to make a transaction from that very wallet. Another example of how decentralization is taking place. An impact in the field of clinical research is also highlighted in the report by the Istituto Superiore di Sanità on decentralized clinical trials. In this case, we are still at the very beginning of any potential use of blockchain technology and DLTs, so much so that on page 42, their role is mentioned as a way to prevent possible violations in the collection, transmission, and storage of data. There are also other examples to mention, and these will be discussed soon. What I think is important to convey today is that decentralization is already intertwined with the field of health and healthcare. And if this connection becomes even deeper, the Blockchain for Health channel will be here to document it. Starting from the next video, we will go into more detail and share more stories. Startups and projects that are already using this technology, specifically applied to the healthcare sector. You will find the bibliography in the comments below the video. If you are interested in these topics, subscribe to the Blockchain for Health channel and click like. Thank you for listening and see you next time. Goodbye.